On average, teenagers who present with endometriosis symptoms see 4 or more doctors before receiving a correct diagnosis. The average time to an endometriosis diagnosis is 4 to 10 years and longer if your onset of symptoms is from age 12 to 18. And research shows the longer someone goes without management, intervention, or a diagnosis of endometriosis, the more likely they are to have nervous system involvement. This means that your nervous system learns pain patterns, and when your nervous system learns pain patterns, it doesn't need a physical stimuli like a physical endometriosis lesion to trigger pain, which means surgical intervention becomes less effective or not effective at all. Additionally, a delayed diagnosis results in increased pain, poor quality of life, and poor long-term fertility outcomes. In 2018, 16 years from the onset of my own endometriosis symptoms, I finally had laparoscopic surgery. While it was so affirming to know I wasn't crazy, my symptoms did not resolve. This is why I'm so excited about the topic of today's video. If you're a teenager or young adult dealing with pelvic pain, or you have a teenage daughter with pelvic pain, I have some really exciting news to share with you today. A groundbreaking new study has identified specific microRNAs in the blood that could diagnose endometriosis without surgery, and these biomarkers are completely different from what we see in adult women. Before we dive into this game-changing research, please like this video, share it with a friend who needs to hear this, and hit the subscribe button. Here's the reality. If you're a teenager with endometriosis, you're waiting on average 14 years to get diagnosed. That's not a typo. 14 years. Compare that to adult women who wait about 8 to 10 years, and you can see that young people are being failed by our current diagnostic system. Why does this happen? Well, according to research, adolescents wait 3 times as long before even seeking care compared to adults. 6 years versus 2 years. And once they do seek help, it takes another 5.4 years before they get a diagnosis compared to 1.9 years for adults. But here's what really gets me. 65% of adolescents report not being taken seriously, and nearly 70% are told that nothing is wrong. This is unacceptable and is exactly why this new research is so important. So what is the study? Let's talk about this study. Researchers at Yale School of Medicine enrolled 63 adolescent and young adult women between the ages of 13 and 26 who were undergoing laparoscopic surgery. Here's what makes the study so important. They collected blood samples and used RNA sequencing to analyze microRNAs in the serum. MicroRNAs are tiny molecules that control gene expression, and they can be measured through a simple blood test. The study included 31 participants with surgically confirmed endometriosis and 20 controls without endometriosis. And here's the key finding. They discovered a unique signature of microRNAs that are completely different from what we see in adult women with endometriosis. Now you might be wondering, what exactly are microRNAs and why do they matter? Think of microRNAs as tiny messengers in your body. They're small pieces of genetic material that don't make proteins themselves, but they control which proteins get made and how much. They're like the volume knobs on your body's genetic control panel. What makes them so useful for diagnosis is that they circulate in your blood, which means we can detect them with a simple blood draw. No surgery required. In endometriosis, certain microRNAs are either increased or decreased compared to people without the condition. This creates a unique signature or pattern that can potentially identify the disease. All right, so what did the researchers actually find? They identified 859 different microRNAs in the blood of adolescents with endometriosis. Of these, 488 were increased and 391 were decreased compared to the control group. But here's where it gets really interesting. They narrowed this down to the microRNAs that showed the clearest differences between those with and without endometriosis. 4 microRNAs were significantly increased. Instead of reading these off, I'm just going to put them right on the screen here for you to see. And 18 microRNAs were significantly decreased. And I'm going to place these ones on the screen for you as well. They also identified 14 others that have never been reported before in endometriosis research. Now here's the game changer. When they compared these results to previous studies in adult women with endometriosis, they found that adolescents have a completely different microRNA signature. Out of the 22 most significant microRNAs they identified, 14 of them had never been reported in adult endometriosis studies before. So why does this matter? First, it confirms what many of us have suspected. Adolescent endometriosis is different from adult endometriosis. This makes sense because we're likely catching the disease in its earlier stages in younger patients. The disease hasn't had so much time to progress and cause the widespread inflammation and structural changes we see in adults. Second, this could lead to a non-invasive diagnostic test specifically for adolescents. Right now, laparoscopic surgery is considered the gold standard for diagnosis, but that's a significant barrier. It's expensive, it requires anesthesia and recovery time, and many doctors are hesitant to perform surgery on teenagers just for a diagnosis. A simple blood test could change everything. It could reduce the diagnostic delay from 14 years to potentially just months. It can avoid unnecessary surgeries, allow for earlier treatment, which could prevent disease progression, reduce years of pain and suffering. It can lower healthcare costs, and it can improve quality of life during critical developmental years. An earlier diagnosis means earlier intervention. And we know from research that early treatment can potentially slow disease progression, preserve fertility, and reduce the development of other comorbidities associated with endometriosis. Now let's talk a bit about why these specific microRNAs matter and what they tell us about endometriosis. Some of the microRNAs they identified are involved in immune function. And remember, endometriosis is fundamentally a condition of immune dysfunction. The body's immune system fails to clear endometrial-like tissue that grows throughout the body. Second, inflammation. Several of the microRNAs regulate inflammatory pathways. We know that women with endometriosis produce higher amounts of inflammatory chemicals like prostaglandins and cytokines. Third, hormone regulation. Some microRNAs affect estrogen and progesterone signaling. Endometriosis, as we know, is an estrogen-dependent condition, and progesterone resistance is very common in endometriosis. Next, cell growth and proliferation. Certain microRNAs control whether cells grow, divide, or die. In endometriosis, we see abnormal cell growth and survival. What's fascinating is that some of these microRNAs are produced directly by endometriosis lesions and are released into the bloodstream. Others are produced by the body in response to the inflammation caused by endometriosis. Either way, they create a detectable pattern in the blood. So what are some of the study strengths? This study has several important strengths that make the findings more credible. One, it was prospective, meaning they enrolled patients and followed them forward in time rather than looking backward at old records. Two, the researchers analyzing the microRNA levels were blinded to whether patients had endometriosis or not. This prevents bias in the results. Third, almost all subjects in the endometriosis group had surgically confirmed endometriosis, the gold standard. And all the control subjects also had surgery, which means they could definitively rule out endometriosis in that group. Fourth, the control group included patients with other pelvic pathologies like ovarian cysts and teratomas. This is important because it suggests these microRNA markers can distinguish endometriosis from other common conditions, not just from healthy individuals. What about some study limitations? This study does have some limitations. First, the sample size is of course very, very small, 31 with endometriosis and 20 controls. We need larger studies to validate these findings. Second, the study was done at a single institution with a predominantly white population, so we don't know if these results apply to all ethnic groups. Third, most patients were using hormonal treatments, which could potentially affect microRNA levels. We don't know for sure quite yet. Fourth, the control group included patients with various ovarian masses, which could theoretically affect microRNA composition. Fifth, they couldn't stratify results by disease stage because most participants had stage 1 endometriosis. The researchers acknowledge these limitations and emphasize that these findings need to be validated in larger, more diverse populations before this could become a clinical diagnostic test. So what does this mean for you? So if you're a teenager or young adult with pelvic pain, or you have a teenage daughter with pelvic pain, what does this mean for you or for your daughter right now? In the short term, unfortunately, this test isn't available yet. This is early stage research and it will take time to develop a commercial test, validate it in a larger study, and get regulatory approval. However, this research is incredibly promising. It shows that your symptoms are real. There are measurable biological differences in your blood if you have endometriosis. Early stage disease detection is another important consideration. Even stage 1 endometriosis produces a distinct microRNA signature. If this test becomes validated, it provides a non-invasive diagnostic test. We don't necessarily need surgery to diagnose endometriosis if this test becomes validated. Adolescent endometriosis is unique. You're not just a younger version of an adult patient. Your disease may have distinct characteristics. In the meantime, if you're experiencing symptoms like severe menstrual cramps, chronic pelvic pain, pain with intercourse, heavy or irregular periods, digestive issues during your period, and or fatigue, don't let anyone tell you it's just a bad period or it's all in your head. Advocate for yourself. Ask for a referral to a gynecologist who specializes in endometriosis, preferably one who has experience with adolescent patients. And be sure to check out my video on tips for your first specialist appointment. That might help you prepare a little better. So what's the bigger picture? This study is part of a larger movement towards precision medicine in endometriosis. We're moving away from a one-size-fits-all approach and towards understanding the unique characteristics of a disease in different populations. Previous research from the same lab identified a different panel of 6 microRNAs that could diagnose endometriosis in adult women. The fact that adolescents have a different signature tells us that the disease may evolve over time, or that catching it early reveals different biological processes. This also has implications for treatment. If we can diagnose endometriosis earlier, we can start treatment before the disease progresses, potentially prevent the development of more severe disease, preserve fertility, prevent the chronic pain sensitization that happens when pain goes untreated for years, and reduce the risk of developing associated conditions like autoimmune diseases. Let's wrap up this video with some practical takeaways. If you're a teenager or a young adult with symptoms, document your symptoms. Keep a pain diary noting when pain occurs, how severe it is, and what helps or doesn't help. Don't accept dismissal. If a doctor tells you your severe pain is normal, seek a second opinion. Ask about a clinical diagnosis. The American College of Obstetricians and Gynecologists now supports clinical diagnosis of endometriosis without surgery in many cases. Focus on what you can control. While we wait for better diagnostic tests and tools, work on optimizing your gut health, reducing inflammation through diet, managing stress, and supporting your immune system. If you're a parent, take your daughter's pain seriously. Severe menstrual pain is not normal. Advocate for appropriate care. Don't let doctors dismiss symptoms as just bad periods. Consider seeing a specialist. A gynecologist with endometriosis expertise is ideal. Support lifestyle interventions. Help with meal planning, stress management, and other supportive strategies. And for everyone else, share this information. The more people know about endometriosis in adolescents, the less likely young people are going to be dismissed. Support endometriosis research. Studies like this are only possible with adequate funding and advocacy. And stay informed. Subscribe to this channel for updates on endometriosis research and management strategies. So this study represents a major step forward in our ability to diagnose endometriosis in adolescents and young adults. While we're not quite at the point where you can walk into your doctor's office and get a blood test for endometriosis, we are getting closer. The identification of a unique microRNA signature in adolescents tells us that early stage endometriosis is biologically distinct and detectable. This opens the door to early diagnosis, early treatment, and hopefully better outcomes for the millions of young people suffering with this condition. If you found this video helpful, please give it a thumbs up and share it with anyone who might benefit from this information. Drop a comment below and let me know, are you someone who experienced symptoms as a teenager? How long did it take you to get a diagnosis? Your stories matter and help others feel less alone. And if you want to learn more about managing endometriosis naturally, check out my other videos on supplements, diet, and fertility with endometriosis. I'll link some of the relevant ones in the description below. Thanks so much for watching, and I'll see you in the next video.